Even with today's cutting-edge healthcare, many diseases still lack complete cures. Take cancer, for example. Current treatments like chemotherapy are toxic and often carry deadly side effects. The reality is, 1 in 3 cancer patients will die within 5 years of being diagnosed. But what if we could administer precise cures for major diseases, free of side effects or harm to your body? Investment Senior Associate David Tan from our Life Sciences team shares with us the sector's investment potential.
Well, if we look at the worldwide drug prescription market today, it's forecasted to be worth about $1 trillion by 2020. And if you look at the cancer market specifically, it's forecasted to be about $150 billion. The chance of anyone developing cancer is about 40%. So if you imagine one day in the future, if we can develop a cure for cancer, this will not only have great benefit to society, but also from an investment point of view, presents great opportunities for a player like Temasek. Temasek has a very long-term investment horizon, so we like disruptive innovation, technologies that we can be invested in today and be invested in for many decades to come. We've invested in companies that are developing curative treatments for infectious diseases, for example, hepatitis C, a viral infection that can lead to liver failure. Just last year in Singapore, we saw that there was an outbreak of hepatitis C that was quite severe. Looking ahead, we're also investing in companies developing therapies for cancer, and one of these is immunotherapy. Immunotherapy is about stimulating our body's immune system to detect and destroy cancer cells. Our bodies actually have the capability to do this, but cancer actually has developed ways in which to evade capture by the body. Now, T-cell immunotherapy is a type of immunotherapy that involves taking a patient's T cells, which is a type of immune cells, out of the patient's body, activating them, modifying them so as to enable them to detect cancer cells in the body, and then putting them back into the patient. Now, these types of treatments are still being tested in the clinic today, but preliminary data has shown great promise for certain types of blood cancer patients. Let's imagine a day when we can use genomics, which is the study of our genes, in order to predict the kind of diseases that you might be prone to getting. And then using that information to make lifestyle changes, such as eating more healthily or exercising more, that can reduce your chances of developing disease. And even if you do get the disease, being able to find the best treatment with the highest potential to curing you completely, enabling you to live life to the fullest.